Are you feeling lost in life? Have you found your purpose or your calling? If not, I'm here to help. And even if you have, come tune in and listen to learn about all that's out there. Welcome to Find Your Power podcast. I am your host, Avery Jane. Today I'm speaking with Amy Magnuson, a health center director of one of the top universities in the nation. Thank you for coming to my podcast, Amy.
You're welcome. Thank you for having me.
So, to start out, what does a health center director of a university do, and what kind of responsibilities does this job entail?
That's a great question. Thank you for that question. The overarching, probably objective of a health center director is to support the staff and the students. So, depending on the size of the staff, would depend on the scope of what that would look like. For us, we have a pretty good sized staff. We have 100 full time staff, and in the fall and spring, we have about 50 or so, like go part time and student staff. So, one of my goals is to ensure that the staff feel supported and that they have a clear scope and direction for their roles,
Mhm.
and provide that ongoing support and remove any types of barriers that might be in their way to providing good quality care for our students. Second part of my responsibility is supporting the students, because that's
Exactly.
why the student health center is there, is to support our students and make sure that they stay healthy so that they can succeed academically. And so it's important that we're always listening to our students and trying to understand what they need and what they want in order to keep them healthy and well to be successful academically.
Okay, and in all of that, do you work mostly in the office or at home or hybrid?
I work mostly in the office.
Mhm.
Students really prefer to get their health and well-being resources face to face. A lot of our students do. Since they're on campus,
Right.
we're on campus, so I'm mostly in the office.
And that totally makes sense. And through COVID and everything, did you guys switch to virtual?
We definitely switched to virtual during COVID, although we also stayed open because even though most people were remote, we still had some students on campus, graduate students, and some international students at the time. And so
Right.
we were still face to face, but we provided during COVID, majority of our care was provided virtually.
Okay, yeah, for sure. And what are some of the positions that your coworkers have? You mentioned that a lot of your job in general is supporting them, your coworkers, and the whole faculty of the building, the people that you work with most in general.
So our leadership team consists of medical director, and he's over all of the clinical operations. So all of the physicians and medical staff, nurse practitioners, physician assistants, and RNs and MAs. So that's a big team. He's also responsible for our physical therapy team and our diagnostic imaging team. So he's got a very big role. In addition, we have an associate director who manages and oversees all of our student support services. So those are staff who help students navigate things like their health requirements, like compliance and immunizations and insurance and stuff like that. And she also oversees the insurance billing part, the business office. And IT is also a very big part of what we do, because IT is changing by the minute. Technology is changing by the minute. So we want to make sure that all of our services are easy to access for students. So if they want to schedule an appointment on the phone on their phones, we want to be able to
Mhm.
make that happen,
Yeah, for
or
sure.
check in on a kiosk and things like that. So we have a real strong tech
Mhm.
team as well. And clinical operations is another component with like referrals. So if you come in and you need to see a specialist, we have a whole team who helps get you to that specialist. So that's a role on our leadership team as well. And I'm going around the table. Business office is a leadership team member as well, just managing all the business operations.
And when it comes to the IT team that you work with, are you guys incorporating any AI recently into your system?
Yeah, that's a great question. So that are the AI would be incorporated through our electronic health record. And
Mm.
right now, with our electronic health record, there are a lot of add-ons, and one of those add-ons is a AI type um, verbal facilitator, like when you go in and see the doctor and they're talking through that automated visit, and
Mm.
that all can be pre-populated. So we are starting to get into some of that, and yeah, there's a lot on the horizon with that AI and healthcare for
Yeah,
sure.
for sure. So, what schooling did you do before you got this job? And also, you can kind of share what your major was in college.
So my approach was a little probably untraditional because I started off as a dietitian, and I my education was in nutrition and exercise physiology. So my initial experience was as working in a physical therapy department as an exercise physiologist, and I got a little bit of experience working in the hospital setting. And then when I started at FSU, I started off as the dietitian, and then the health promotion director job opened up, and that was who I was reporting to at the time. So I thought I could probably do that job. And so I got that job right around the time I was pregnant with my second, and that was, I really enjoyed that. But that was within the health center. It was our health promotion department. And then when our health center director retired, they asked me to step in and serve as the interim health center director. So I did that, and I actually really enjoyed it. So then I applied for the permanent position and got it.
Very cool. Quite a journey
Yes.
to get there. Yeah, so through that whole journey, is this the career path that you wanted to go to in the beginning? I guess it kind of showed that you started with being a dietitian, but when you actually started with schooling, did you see that as your final job or your final career? Or what exactly did you go to college for in the first place?
That's a great question. I had no idea that I would have been a health center director. I would have never guessed that. And when I was in college, I wanted to be an actress. So then I took nutrition and decided I wanted to be a dietitian. And so that
Mm-hmm.
was my first kind of professional career, was a dietitian,
Mm-hmm.
and which I still am, but I don't serve in that role full time anymore.
And you totally gave up the dream of being an actress?
I did. I did make one of the major plays when I was in sophomore year, so kind
Mm.
of gave it up. Yeah.
Sophomore year of college,
Yeah.
or okay. So I would say in that case that taking the nutrition class kind of influenced you to going into this career.
100%.
Hmm.
Yes. Yes.
Okay, okay. And was that class like given to you to take, or did you just pick that because it sounded interesting in college?
Oh, that's a good question. I think I was just kind of interested in it, so I took it, and then I decided I wanted to major in it.
Hmm. But you were still on the path for being an actress
Yeah.
for the major of arts.
The other interest I had was the exercise physiology interest. I was
Okay.
really,
Yeah,
but I didn't know what I could do with that
sure.
major.
So you were kind of taking classes for both at the
Hmm.
time. Yeah. So what are your interests outside of this job? Any hobbies? Still acting or anything?
Well, I don't act,
Mm,
but I
funny.
like to stay active, hiking and beach trips, and I really like to go visit my kids and
Mm,
spend time with them. And yeah.
very cool. So in that, with all of your hobbies and interests that you can do outside of this job, would you say that your power, your purpose in life is found in your job or outside of your job, in your hobbies, or a little bit of both?
Oh. My purpose in life is probably trying to be a good role model for my kids.
Okay, yeah, for sure. And you'd say there's only one for you.
Probably.
So, what is your favorite thing about working as a health center director? If you had to pick.
That's a hard one because there's a lot of things that I really enjoy. I really enjoy working on a college campus. I really enjoy being in healthcare, especially right now because there's so much with technology and healthcare that's changing
Mhm.
fast and it's exciting. I really enjoy leading a group of people who are very committed and devoted,
Mhm.
and I really enjoy being around college students because they're exploring what they want to do for the rest of their lives, which is really cool. Um,
Very energetic, very
they're
lively.
yes, yeah, yeah, and help keep me relevant to current day stuff. So it's hard for me to pick just one. Mm,
That works.
yeah.
What is one piece of advice you would give to someone that's looking into getting into this career path specifically?
This career path specifically, you could get to from a lot of different avenues. Mine was probably a little different, but not so unusual because there are other healthcare leaders that have kind of worked their way up the ranks, which is kind of what I did. You could go into higher education if you're interested in working on a college setting, healthcare if you were went into any kind of healthcare field. Uh, that could set you in a good place to be a health center director as well. So there's and even healthcare management if you wanted, that would actually be a great background as well.
So it sounds like there's a lot of different approaches you can take to get into this career, which is
Mm-hmm.
good. And to piggyback off of that question, what is another piece of advice you would give for somebody who doesn't know what they would like to do for a
Mm-hmm.
career?
Well, it's really hard to decide what you want to do for the rest of your life because that's a really long time. And so I would just encourage someone if they were in college to take classes that they are interested in and look for opportunities, even volunteer opportunities or student organizations or things like that to get involved with that they just have an interest in, and a lot of times that will guide you into your field.
For sure. And that's kind of how you got into yours in the
Mm-hmm.
first place as well. Okay, well, I think that wraps up my questions. Thank you so much again for joining me today on the podcast. Hope to talk to you again soon.
Thank you, Avery.
Thank you so much for tuning in and listening. If you enjoyed, please rate the podcast and feel free to leave any comments or reviews. If you're on the path to finding your power, and a lot of times it's a never ending path or journey, then join me in doing the same. Tune in every Thursday to listen or watch on YouTube or Spotify. Also, make sure to check out the Instagram at findyourpower_podcast. And you can feel free to DM me with any questions or suggestions. I will be pulling advice questions as well for future episodes from there. And lastly, if you would like to be featured for an interview, you can send me an email at the email linked below in the description. I will talk to you guys again soon. Thank you so much for tuning in today. And don't forget, we will find your power.